Hi, we just wait for people to join. So we're going to be covering a live question and answer physio for home workers with back and neck pain today. Hi Stephen. We're just hanging around just to wait to see if anyone else is coming online to have a watch. So if anyone's got any questions today, any people that are working from home at this time and are struggling with any neck or back problems, then just put a comment, put your question in the comments and I'll do my best to answer them today. Hi Tiffany. So I hope everyone's keeping well. Alright. Hi Wendy. So as I say, if anyone's got any questions then about neck and back pain, then always put something in the comments below and I'll answer them today. So I'll get going because I have had a few questions come in via our social media pages. So I'm Natalie March, I'm from Physio-logical, so we're a local physio clinic in Havant, Horndean and Romans Castle. So what I'm doing today is answering some live question and answers about back pain and neck pain for those that are working from home at the moment. So I'll get straight on. Yeah, one of the questions that I had is I am a triathlete who's working from home. I've had lower back pain flare up. So in the past I've had a previous history of a disc prolapse, so a prolapsed disc in the back, and I'm not sure what I should be doing at this time. So hi Emma. Okay. So the answer to that is basically, so from a physio point of view, is working out what is actually the cause of that back pain. So we'd be able to do a full assessment where we ask lots of questions about, where the pain is and what particular movements aggravate the pain. So from that, then we'll be able to come up with a diagnosis and determine what the main cause of the pain is. So depending on what movement hurts gives us an indication of what the structure is like to be causing the pain. So all I would say to this particular person that answers this question, when it comes to disc problems, it's really low percentage. Most back pain is just because of mechanical problems, so certain muscles being tight, certain joints being stiff, and that causes the pain. As I say, we'd do a full assessment, so we'd ask detailed questions, which movement hurts, where the pain is, and then from there determine is it a disc problem or not. So other things to think about, so if it is a disc problem, then what normally tends to happen is you get severe back and leg pain. So you would have heard of sciatica, so where you get pain down the whole leg, that usually can be an indication of disc. Obviously other things and other structures can cause leg pain, but sometimes that is to do with a disc. So if it is just a localised like lower back pain, then the chances are it's probably just more mechanical back pain due to certain muscles being tight, certain muscles being weak. The other thing, if we're thinking from a disc prolapse point of view, if it tends to be worse with bending and sitting and lifting. So if you're getting problems with that, that could indicate more of a disc. And also you can sometimes get pins and needles or numbness in the leg. So as I said, just to be reassured, this person that answered this question, less than 1 in 20 cases of sudden onset back pain are due to a disc prolapse. So that is quite low, and most cases are just simple lower back pain, as I said, because of a minor problem with the muscle or strain in the muscle. So therefore, if you've got a sudden increase in back pain and you're working from home, whether it's a disc problem or if it is just like mechanical simple back pain, what should you be doing? Okay. Oh hi Bev and Lauren, thanks for joining us. So what should you be doing? So the main thing, the first thing to do if you've got a sudden increase or a sudden acute onset of lower back pain is to get the pain under control. So you need to if you've got some paracetamol and you're fine usually taking that, take some paracetamol, ibuprofen, speak to your pharmacist and just, you know, to make sure that you are okay to take them if you're on other medications as well. Because the sooner you can take the you know, simple pain relief, the sooner the pain's under control, and then you can start moving. So you're much better. I always get this question, but I don't want to take pain relief because I won't know whether I'm causing more damage or not. So it's much better to take pain relief, so you can keep moving and keep pottering about, rather than getting stiff and weak and then the pain just be ongoing. So take some simple pain relief. As I say, if it's not settling with medication from the pharmacist, it might be, if it is an acute disc problem, sometimes speaking to your doctor to see if there's anything stronger from a nerve pain point of view. There are other medications you can take. But the key is simple pain relief and to get moving. So if you are working from home, keep moving every 20 minutes or sooner. So if you have pain when you stand up, then the chances are you've sat for too long. So you need to be moving regularly. So as I say, the guide is when you stand up. If you stand up and it's painful, then you've sat for too long. So next time, sit for less. Gently, sort of gentle movements and stretches in the morning and throughout the day just to ease stiffness. I'll go into exercises a bit more in a minute. Look at your posture and positioning when using the computers. I've had a few like students working from home that have got poor desk setup, so I know it's hard at these times, but trying if you can to get like your computer set up the best you can. And if you are using your iPhone or iPad a lot in the evening, you know, try not to end up into more of a flex posture. So try and build it up to you what you're using the device, so you end up so you don't get into bad postures. Mattress is really important. So if you're getting a lot of pain first thing in the morning, then just making sure, you know, just have a think about when you last changed your mattress. So I always find that there's a lot of people always ask me the questions, what mattress should I get? Well, I know it's just down to you really. You don't want anything that's too firm, you don't want anything that's too soft, so it's just finding that what suits you. Because I know I've had some people that go out and buy these really firm, really firm mattresses, and actually that was worse. So it's just finding one in the middle really. I know a lot of us obviously aren't driving that far at the moment, but if you are driving for work, just make sure that your chair in your car is set up the best you can. So what we find with ongoing back pain is actually if you end up sort of your hips are slightly lower than the knees, you end up slump sitting, and that puts more strain through your back. So if you can get like a slight wedge cushion so your hips are about 10 degrees higher than the knees, that stops you ending up getting into a slump sitting position. Because driving can be bad if you've got an acute flare-up of your back. And then just generally, well, that's good to see, Phil. So you got your new mattress last week. Hope it's going well. And yeah, eating a healthy diet, you know, healthy diet and exercise, because being overweight obviously can put more load through the back as well. So as I said, the question, going back to the questions, a few more people have joined us now. So the question I've had is, I'm a triathlete who's working from home. I've had an increase in my lower back pain. I've got a history of a disc prolapse. What can I do? So as I say, we'll do a full assessment to determine if it was a flare-up of the disc prolapse or not. As I said briefly earlier, less than 1 in 20 will be a disc. So I'm just talking about how to manage an acute flare-up of back pain generally. So depending on where the pain is and when it hurts is the key, is depending on what exercises we give you. So the key from a physio point of view is, one, to get the full movement back, and then longer term we need to strengthen through your core muscles, your deep tummy muscles like your corset and your glutes muscles, so it's strong to reduce the risk of reoccurrence, because we all know that once you've had back pain, it's really high, like it's 80% chance of reoccurrence. So it's really important to get as strong as you can. So if a couple of exercises to do if you're struggling to bend forward, so then good exercises to do are the opposite, to bend, arch backwards. So I'll just show you that. So if you're getting a lot of pain, so if you've had an acute onset, you know, of lower back pain, and you're finding that actually to bend forwards to touch your toes, that's really quite sore, then a good one to do is just find a wall and then just doing sort of arching back there. Yeah? So what we find is that if you struggle with your bend, then normally if we actually go the other way, that will then help improve that bending movement. And it's the same with your extending. So if you're painful to extend back, what we find if you do more exercises to bend forwards, this opens up the joints, then that takes the strain off around the joints and then can ease the pain. So I'll just show you what the reasoning behind that on the spine. So I've got the spine here. So basically what we find, so if I come from the back there, so if you extend, so go backwards like that, that does put more pressure around the joints to close down the joints there, but it can offload, it does offload around the discs which are in between the vertebrae. So what we're talking about here is the lumbar spine, lower back. So lumbar spine is L1 to L5, so these are all the vertebrae. You've got the joints either side here, we call facet joints, and then in between each vertebrae here, we've got the discs here, yeah? So with disc problems, we tend to find that you don't like going into what we call flexed bent postures. So by doing lots of extended postures, going arching back, that can offload pressure, that will offload pressure around disc and help with those sorts of symptoms, yeah? So just to say, so if you're getting a lot of problems bending forwards, then good to do is arching back exercises. And if you're getting problems arching back, which you can indicate sometimes, so if you arching back, that gets problems, so stiffness sort of within the joint, so therefore the exercise to do that. So if you get pain arching back, the exercise to do is bending forwards. And if you can see there, when you bend forwards, it obviously gaps the joint, so it takes pressure off away from the joints more, yeah? And then another just general one to do if you've got just general back pain is doing a side to side bend as well. So I'll just show you that. So literally just doing sort of down one way, yeah? And then the other one going down the other way. So how many should we do of these? So if you've got an acute flare up of back pain, then so if it's painful to bend forwards, the two exercises to do initially is your arching back. You can do that in standing against the wall, but you can do that lying on your front and then pushing up on your hands, arch back. And if you've got pain when you arch back, then you're better to do your bending forwards one and your side to side bend. Okay, so depending on which way you're getting the discomfort, you move in the opposite way. So based on that, you want to move regularly. So looking at like 10 3 times a day with those ones, yeah? So keep moving. And then it's also really important to get strong too. So once you've got the movement back and the pain starting to ease, the sooner you can get going with strengthening exercises to strengthen up through your core, your deep tummy corset muscles, and the glutes, the bottom muscles, the less load it will put on your lower back. So things like bridging, so that's where you are on your back, knees bent, and then just bridge up. I think I've got a sheet here. I've got the bridging one here. Yeah, so I'll just show you on the sheet, and I'll post this under as well, so if you want more information. So we've got your bridging one there. So knees bent. Key with bridging is push down through your heels and squeeze your bottom muscles as you lift your legs up. Sorry, lift your hips up. So push through your heels and squeeze your bottom muscles as you lift your hips up. So that will really help to strengthen through your glutes, your bottom muscles there. Yeah, so bridging's a good one to do. Sit to stand, quite an easy one. So just cushion your arms over your chest. Obviously use a dining room chair or something that's not going to move. And really with this, really again, push down through your heels and squeeze your bottom muscles as you stand up. So it's just a sit to stand, yeah? And that might seem like a simple exercise, but if you've got an acute flare up of lower back, bad lower back pain, it's a really good one to start to get the bottom muscles working to then support and offload around the lower back. And another good one to do is, if there's any Pilates or yoga people watching, I call it core leg drop. You know, I've heard some people call it dead bug and some people call it like a core and toe tap. So the exercise for for your core, your deep tummy muscles, is this one here. So it's just lying on your back with your knees both bent up and hips bent up 90 degrees, and you just slowly lower one leg down, just toe tap and then coming up. And what's that's designed to do, that's going to strengthen through your core muscles. So your core muscles, your deep tummy muscles, which wrap around like a corset that supports and stabilises around your back. So just with that one, obviously just it shouldn't be painful in your back when you're doing it, you know, that particular exercise. You need to keep your back flat on the ground, so your back doesn't arch as you lower your leg down. Yeah, so that's your core one. So we've got two glutes. One's your bridging and your sit to stand, and then that one that I've just said about the core. What I'll do is I'll share these exercises just under this post afterwards too. Okay. Hi Emma. So that was the summary. So a triathlete who's working from home has an acute flare-up of lower back pain, previous history of disc prolapse. What can he do? Yeah. And yeah, just to say that, you know, Physio-logical, we see 30% of our clients do have back and neck pain, so it's really really common in the people we see. And just we, you know, from our point of view as a physio, we take time to listen to patients and then work with them to achieve their goals and get them back to the activities they want to do. Okay, so if anyone that's watching live, if you've got any questions, please feel free to ask in the comments and I'll answer them as we go. Hello? Okay, so if not, then we will carry on. So I've got another question that was asked prior to this today, and the question was, I'm working from home and have developed neck pain. Should my desk be set up in a certain way, and is there anything I can do to help the fact that I've got this sudden increase in neck pain? Okay, so obviously with the current situation, lots of people are working from home, and I know a lot of my patients are having to work on their dining room table. Worst case scenario, you know, if you're trying to homeschool the kids as well as work, then people are on their laps. You know, obviously our main bit of advice is, I know they're called a laptop, but try not to work on your lap. You know, try and get the best setup you can. So we'll just we'll talk through that. So if you can, you know, if you're using a laptop, then, you know, obviously try and go to your dining room table, or if you've got an office space, then obviously go to the office. You want to put your laptop, if you can get a laptop riser, so your laptop's, you know, eye level, so you'll not end up sort of slumping, poking. So a lot of people we see with neck pain, it can be like just postural basically. So is rounded, because you're using your device low, you end up rounded shouldered, chin poking, and then you overload certain area in the neck. So it's just key to get that workstation set up well. So that's good. Oh, I'll answer that question in a minute, Phil. So I'll just carry on with this one and then we'll come to you, Phil. So yeah, ideal setup, desk, good supportive chair if you can. If you're losing a laptop, put it on a laptop raise. If you can, the ideal would be to plug in so you've got your separate monitors, keyboard and mouse, so you're not actually using the keys of the laptop, and then at arm's length away, so when you reach out, it's at arm's length. So as I said, I know a lot of people are having to adjust at this time and work from home, so that's the best way, you know, you can set up your workstation. So try not to work on your lap. You know, me and my husband are both working from home at the moment, so we try and do shifts. There's a lot of people are, I'm sure, so one will get up early, do the morning shift, then do the schooling, and then the other one will work late, so try and do that. And yeah, if you haven't got a laptop raised, because I know a lot of them went out of stock in the early days, then use a book or some, you know, pads or paper pads or something just to raise your laptop up to a better height. Then yeah, just do the, you know, best you can. And also dining room chair, so it's not ideal, but dining room chair, if that's all you've got, then a lot of people benefit from a wedged cushion, so your hips end up slightly higher. So when you're sitting down, it's just so your hips end up slightly higher than the knees, So if you're by about 10 degrees, to stop you getting into those slumped positions, because it can irritate the back and the neck. So you can buy those online just to get you into a slightly better position. So yeah, that's the best way you can set up your workstation, and until you can get hold of any resources. And then it's really good, as I've said before, as always, just move regularly. So move every 20 minutes. So there's a lot of research done not too long ago about posture. And as a physio and a lot of other professions, we always used to say, you need good posture, all the time. But what they've found now is it's unrealistic and actually can put more strain on the muscles by trying to encourage people to sit bolt upright all the time. So sitting postures don't then match people's natural shape of their spine, and then they look uncomfortable. It might appear to look comfortable, but it's uncomfortable, and then it can put excessive strain on the muscles and actually can cause more problems. So instead of getting people, sit up, shoulders back, then what, from a physio point of view, and all the research is showing now, it's actually get people to move. If you move every 20 minutes, you change your position, and then you get, obviously when you sit down again, you're in better postures. And also, take advantage of, you can get like standing desks and things like that there now. Yeah, so if you don't, the research article that I'm quoting is O'Sullivan in 2012, the outcome of that is, if you don't have back or neck pain, then do not give your posture a second thought. Think about being healthy, because it's more likely sleep deprivation and stress are more important, and stress can have a strong inflammatory role. It can make muscles tense, and most people don't understand then their neck pain or back pain becomes sore if they're sleep deprived. So again, talking about general health and with ongoing aches and pains as well. So good sleep, good nutrition, and exercise, and move regularly. Every 20 minutes or sooner if you get pain when you on standing. So exercises for neck pain. So obviously these are, all these exercises I'm giving you are, general guides. So it's always better to seek advice from a, healthcare professional to get specific tailored exercises for you. Don't push into any sharp pains or anything. And if you've got any questions, then always put it in the comments or drop us an email. Enquiries at physio-logical.net. We've also got lots of resources on our website, which is physio-logical.net, on our blog page. So exercise to do. So if you're getting neck pain when in your home working, a lot of the time it ends up because you end up in chin poking postures. So a really good one to do is just a chin tuck exercise. So just here, and chin tuck back here, and then relax. So hold for 5, and then relax. So what this does is, what we're trying to do is just to help mobilise through the neck, and stop the increased load through the muscles from being into a chin poking posture. So 5 seconds, 10, 3 times a day. And then other ones good, just general mobility. I find just shoulder shrugs and rolls. 10, 3 times a day. General looking side to side, so neck rotations, just regularly 10, 3 times a day. And another good one is to get a bit of TheraBand, tie a knot in it in the door, and then just do what we call a low row. So just pulling, so imagine some resistance bands, tied a knot in the door, is just pulling back here, because what this does, this helps strengthen these lower muscles here to stop you getting tense through the upper one, which can then also lead to neck pain as well. So that's just answering the question. I'm working from home, have developed neck pain. Should my desk be set up in a certain way, and is there anything I can do? So hopefully that's answered that question for you. Right, just going to Phil. Oh, hi Dave. Phil's put, I've stopped doing sit-ups and switched to yoga. Now I'm better. Should I bother going back to what I'm used to? I've stopped doing sit-ups and switched to yoga. Should I bother going back to what I'm used to? I'm not sure what you mean by that, Phil. So you've stopped doing sit-ups. Should you go back to doing sit-ups? Is that what you mean? Is that in regards to lower back pain? Maybe if you pop a little bit more information, Phil, I'll answer that for you. But I think I think if we're looking at that, it's to do, should you do sit-ups if you've got back pain? I think that's what Phil was asking. So with regards to back pain, that's quite an interesting question actually. So a lot of people feel that actually by doing sit-ups, it gets your core muscles stronger, which helps with your back. So when we're talking about back pain, oh, I hate sit-ups. So do you not want to do sit-ups, Phil? So when we're talking about back pain, actually, you know, a lot of people come to me and say, oh no, my core's really strong, I've been doing lots of sit-ups. But actually when we break them down, it's not their core isn't strong, they're doing lots of sit-ups. But when you do sit-ups, you're not directly working the core muscles. So when you do a sit-up, you're working your six-pack, your rectus muscles here, yeah? These rectus muscles are muscles that are close to the surface. So when we talk about core, these are your deep tummy muscles, transverse abdominis, which are like a corset that supports and stabilises around your back. So actually, if you with certain back problems, doing loads of crunches, loads of just basic like crunches, sit-ups can overload the back. So I always say to people with back pain, you're better not to do loads of crunches. Well, one, because they're not targeting the right muscle, they're not working your deep tummy muscles, your core muscles so much. And two, it can put more load through your lower back. Okay, so you're better to do things like planks. What I'll do is I'll share some of these exercises afterwards. I'll put some comments to blogs on our websites and videos on our YouTube channel. So a plank, just when you do a plank, just on your forearms, keeping your tummy muscle tight and keeping neutral spine. So things like that. The other one that's good to do is I call it a core plus leg drop one. So another good core one is this one here. So it's just keeping your core, your lower tummy muscles switched on, and then just lowering one leg down and then coming back up. So that's another good core one, which doesn't overload through the lower back. And there's also Superman. I call it Superman, Superwoman. So this lower one here, so keeping your tummy muscles tight and then just reaching out opposite arm and leg. So 10-second holds, and just work it until you feel your tummy muscles working. So hopefully that's answered your questions. Oh yeah, so that's right, Phil. So Phil's just saying there he spent decades doing sit-ups, but now he feels yoga and Pilates are more effective and he doesn't get lower backache. Yeah, and I'd agree. So because during yoga and Pilates, they're focused more on the core control and stability and glutes, and rather than just doing your superficial. Sit-ups are your superficial muscles, they're not your deep stability muscles, yeah? So you're much better to be doing sort of yoga Pilates type exercises rather than doing loads of sit-ups if you've got back pain. So that was, so good question, Phil. Thank you for that. And because basically by working your core, it supports and stabilises around the back and then just offloads. So it provides more of a corset that supports you rather than the sit-up muscles don't provide that corset. So it's just going to put more strain through the back. Okay. Right, how are we doing for time? I think we've come to the end there. So if anyone that's watching live, has anyone got any other questions they want to ask? Oh, we all... No? Okay. So we've come to the end of this Q&A session. We're going to do another one in 2 weeks, 2 weeks today. So that's going to be, just looking at my calendar, Thursday the 14th of May. I've just looked at my calendar. That was the day we were supposed to be going on holiday. Anyway, so Thursday the 14th of May, we're going to be doing another question and answer session. So this time it's going to be based on running and triathletes. So running or triathletes injuries. So if you're a runner or a triathlete and has got any injuries, niggles, aches or pains, then watch out for the post or send us any questions you have for our next live Facebook live session. So that's for runners and triathletes. If you've got any niggles, injuries, aches or pains, or want any specific advice about what strengthening exercises you could be doing at the moment, or ways that you can improve your performance and times when we go back to competing and events again, then please feel free to email your questions to enquiries@physio-logical.net, or send us a message via our social media channels. Okay, so as I say, I'll post some of the exercises we've mentioned in this live under this post, so you've got links to where you can look at the exercise in a bit more details. And yeah, so get those workstations set up the best you can and move every 20 minutes. And the key with an acute onset lower back pain or neck pain is to try and take medication so you can then move, obviously speaking to your pharmacist. Okay, so I'll leave you here. Stay safe everyone, and I'll catch up with you again soon. Right, bye.